HPV is the most common sexually transmitted disease, and for some people, it can cause serious health issues. Joining me now to talk about this highly contagious virus is HPV specialist Dr. Nancy Durand and Michelle, who experienced consequences that this infection can cause. Welcome to both of you. Dr. Durand, let's start with you. How common is HPV, and who is most at risk for contracting it?
It would be more common to be exposed to HPV in our life than to not be exposed.
So who's really at risk then?
We would be at risk for HPV if we're ever sexually active during our lifetime, which is the majority of people.
Why the concern about the infection, and what are the potential consequences of having HPV?
Well, the infection itself may not cause any disease, but in certain people it will. Some diseases are not that serious, such as external genital warts. However, other diseases can be very serious, such as cancers. The location of these cancers could be the cervix, the vaginal walls, the outside skin, the vulva, and in men and women, anal cancer, and in men and women, oral cancers caused by HPV.
So widespreading. Michelle, discovering that you had HPV must have been devastating for you. Tell us about your journey and how you coped with it.
I had a hysterectomy. I did not have children at the time, so that choice was taken away from me. So being diagnosed with cervical cancer was devastating to me. I was 37 and I did not know about HPV and the risks associated with HPV until I was diagnosed with cervical cancer.
Aren't there screenings available to help detect cervical cancer?
In 2012, I had a Pap test. My results came back normal. 1 year later, I had a small symptom that I was concerned about, and I requested a Pap test from my family doctor, and I was diagnosed with cervical cancer.
The point of the Pap test is to detect cervical cells when they're precancerous before they become cervical cancer. And in this way, the Pap testing program has helped to greatly reduce the number of cases of cervical cancer. The problem with Pap tests and cervical screening is it's not perfect. So there are cases where we could have disease happening and yet the Pap still shows up as normal. So that would be how a case like Michelle's can happen, because the test itself is not perfect.
What can people do to really protect themselves from getting the HPV virus?
Well, reducing risk is really all we can do, because complete prevention would be never being sexually active in your lifetime, which isn't reasonable. So risk reduction would be things like barrier contraception, condoms. It's not perfect. It's going to reduce your risk by 70%, not 100%. Wow. And then vaccination, we now have available to us since 2006. Women should continue to get regular Pap tests.
When I discovered that I had cervical cancer, I had to do a lot of research. And I then realized that there were vaccines for people that were as old as I was, and even up to age 45.
Why is it that many people associate the HPV vaccine with the younger generation, in particular young girls?
Well, originally, when it first came out in Canada, the programs were focused against school-aged girls because that was the funded provincial programs across the country. However, the vaccine is available now to those over those original age ranges. We have 3 vaccines on the market in Canada approved for use in girls and women aged 9 to 45, and 2 of those 3 are also approved for boys and men from the ages of 9 to 26.
Would you recommend the vaccine for all adults, even those who've already had the HPV virus?
I would recommend that adults be vaccinated if they've not been vaccinated in the school program. And even those who've previously had HPV or currently have HPV do benefit from vaccination. They may not yet have been exposed to all types.
Michelle, any advice for our viewers?
I think you really have to do your own research. You have to be your own health advocate. You have to make your own informed decisions.
Dr. Durand, same question.
I think it's really important that men and women should approach their healthcare provider to have this discussion about HPV and vaccination so that together they can make an informed decision.
Being well educated is key. Dr. Durand, Michelle, thanks so much for your time today.